So basically, we started respiratory system. Yesterday, we talked about inhalation, exhalation, transport of gases in the blood, how it occurs, and exchange of gases. Everything we discussed yesterday. So today, we will discuss about regulation of respiration. How the respiration occurs. Basically, now I am here sitting, delivering a class to you, but in the background, I am also doing respiration, inhalation and exhalation also happen. Okay, my heart also beating. Okay, everything is uh, going on the background. So how this happen? Okay, how the respiration is continuously happening. Uh, in 1 minute, 12 to 20 respiratory rate is there. Okay, so how it is happening? Let's talk about that. Two types of mechanisms regulate breathing. So the mechanism, the continuously the breathing is happening with the help of two types of mechanism. One is nervous mechanism and the other one is chemical mechanism. So basically we need nervous mechanism and chemical mechanism. So those two mechanisms will help us to breathe in the background whenever we are in work. While I am sitting, I'm nothing now doing nothing. So I can sense that I'm breathing. Right? And other things will happen like coughing, how the cough is generated, sneezing. Okay, these are the things are going background. Cough is not continuously will happen, but it is also a process of respiration. First, we will talk about nervous regulation. The respiratory centers. So basically, which is the current? Current is supplying from the brain, the area called medulla and the pons, which are the part of the brain stem. Basically, this is the brain. Okay. So we have brain stem, cerebrum. Okay. We have cerebellum here. Okay. This is the brain stem. Medulla oblongata, pons, brain stem. Everything is here. Okay. So let's see the diagram. So you can see that this is the brain. Okay, all these are brain. Okay, that is this is the cerebrum, cerebellum. We have okay, this is the medulla oblongata. These are the pons. Okay, in that pons we have in the medulla in the pons we have respiratory centers. Two centers are there: inhibitory centers and inspiratory centers and expiratory centers. Inspiration, the center which able to inhale the air, the center which able to exhale the air. So we need two centers. Okay, let's talk about in detail. So first center is inspiration center. Instrument is inspiration center automatically generates impulse in rhythmic strokes. This impulse travel along nerves to the respiratory muscles to stimulate their contraction. The result is inhalation. As the lung inflate, baroreceptors in lung tissue detect the stretching and generate sensory impulse to the medulla. These impulses begin to depress the inspiratory centers. This is called herring barrier inflection reflex, which also help prevent overinflation of the lungs. So basically, so this is the center in the medulla. We have inspiratory centers which are attached to the lungs, both lungs. Okay. Then what will happen? The impulse travel to the nerves, to these nerves, and it will reach to the lungs. Then the lung inflate. It will expand. The air enters. So when the lungs expand, we have receptors. Receptors which detect the how much amount of air is inhaled and to stop the inhalation, because if your only inhalation, what will happen? Lung will collapse. The alveoli will collapse. So that's the reason these receptors give inhibitory reflexes to the medulla. Then the expiration center will activate and the lungs will close. The lungs will relax. Okay. So this is the process. Let's continue. As the inspiration center is depressed, the result is decreased in influence of the respiratory muscles, which relax to bring about exhalation. Okay. Then the inspiration center becomes active again to begin another cycle of breathing. So likewise, the cycle will continue to happen. Okay. When there is a need for more forceful exhalation, such as during exercise, the inspiration center activates the expiration center, which generates impulse to the internal, intercostal, and abdominal muscles. So only internal inspiration center is activated first during our relaxation time. Okay, but whenever we are doing exercises, we are doing any strenuous work, whenever we are doing any particular work which gives stress, so the expiration center will activate because we need more expiration, more inhalation. What will happen? The in the brain, the expiration center. So where the expiration center is there, here we have the expiration center. You can see here. Okay. So this is the expiration center. This is the expiration center. So what will happen? It will activate, the impulse will activate both intercostal muscle and abdominal muscles. When we run, when we are running, how we breathe? Shallow breathing. What will happen? The muscles of the abdomen, the muscles of the intercostal will activate. Okay, so this will happen. The medulla and medulla oblongata expiratory center will activate. Okay, so it will happen. Okay. Next, what will happen? So the two respiratory centers in the pons work with the inspiration center to produce a normal rhythm of breathing. The apastic center prolongs inhalation and is then interrupted by impulse by the pneumotaxic center, which contributes to inhalation. In normal breathing, inhalation lasts for 1 to 2 seconds, followed by slightly longer 2 to 3 seconds exhalation, producing the normal respiratory rate at 12 to 20 breath per minute. So basically, the inhalation, the exhalation, whatever area we have the in the pons, we have that area. Pneumatic center, this is the pneumatic center, which is epinostic center. So what will happen? It will regulate. So this inspiration center, this expiratory center will activate, but we have to regulate that while you are walking, while you are jogging, while you are running. We need more inhalation and we have to exhale whatever we inhale. Okay, so there's a reason to regulation. You can see that these arrows, with the help of these arrows, you can understood. Okay, so here the is expiratory center, the inhalatory center. So here it will enter into the pneumatic center. Pneumatic center will activate aponostic center, and aponostic center will activate again inhalation center, same as exhalation center. Okay. So we need another system to regulate that. So we have in the pons, we have epinostic center and pneumatic center. Okay. What has just been described in normal breathing, but variation are possible and quite common. Emotions often affect respiration. A sudden fright may bring about a gasp or scream, and anger usually increase the respiratory centers, respiratory rate. In this situation, impulse from the hypothalamus modify the output from the medulla. The central cortex enables us to voluntarily change our breathing rate or rhythm or to talk, sing, breathe faster or slower, or even to stop breathing for 1 to 2 minutes. Such changes cannot be continued indefinitely. However, and the medulla will eventually resume control. So basically, the main center is medulla and pons. But we are humans, we have emotions. Okay, so that's the reason while crying, the respiratory rate sometimes increases or decreases. Okay, while singing or while fighting, while fighting. So these are the conditions whenever the requirement of the respiratory rates to be increased, so hypothalamus will modify that according to the condition. Okay, because it have emotional area, hypothalamus will detect the emotion. Okay, so what will happen? It will modify the respiratory rate. Okay, and we have cerebral cortex also help. Cerebral cortex is involuntary movements. Sorry, voluntary movements. Like whenever I am talking, this is my voluntary movement. I know that I am talking. I will in my hand. I want to talk. I want to stop. I want to efface myself. Okay, no sound, no words. These are the voluntary uh, areas. Okay, so cerebral cortex will give the information to the respiratory centers that I am talking. You have to modify your respiratory rate according to that. Singing, okay, or some slow walk, okay. So the respiratory center will modify according to that. Okay, so these are the centers also will helping to the medulla and pons. But the main center is medulla and pons only. Okay. And the second here, very important thing, number of persons will come to you uh, with the problem of cough and sneezing because they are the most common problems nowadays, cough and sneezing. Because most, I think most of the reason due to the polluted air, right? Because in the nostrils we have uh, airs, okay, which will filter the air. But if the air is 100% or minimum 70% polluted, pollutants are there, dust is there, how can your hair will clear all these pollutants? Okay. This is very important. So there's the reason the dust is entering into the uh, nasopharynx, oropharynx, trachea, and in the lungs. So basically, this is the reason. Number of patients have allergies, sneezing, running nose, dust in their eyes. So what we have to do? We have to reduce the pollution. We have to use less amount of vehicles on the road and as well as to clean our surroundings. This is the only way we can protect ourselves and we protect other persons. But treatment, this is not a disease. Any physiological changes is happening. Okay. So you have to protect yourself, like using a mask or paper mask or cloth mask. Nowadays, filtered mask also came in the market. Okay, you have to reduce the pollution, or you have to use like protectants, which will protect the entry of dust. Okay, so basically, how cough and sneezing happens. Okay, how cough and sneezing happens because there is an irritation in the respiratory areas. In the lungs, it will be in trachea, in the nostrils. There is the dust which is very irritating your respiratory system. So what will medulla will detect that this irritant is doing something wrong to the respiratory system. So what will it will activate the reflexes. Reflexes means with the help of medulla, it produces the impulse. There is something which is disturbance. How to remove that? It will reflexes. It will throw it away from that area. So you have to activate all the things. How it happened? Let's let's talk about sneezing is stimulated by irritation of the nasal mucosa, and cough is stimulated by the irritation of mucosa of pharynx, larynx, or trachea. Sneezing will come nasal mucosa due to the nasal mucosa. Cough is come due to the irritation of trachea, larynx, pharynx, and respiratory system. The reflex action is essential same of both. And inhalation is followed by exhalation, bringing the glottis close built up pressure. Then the glottis opens suddenly, and the exhalation is explosive. A cough directs the exhalation out the mouth, while a sneeze directs the exhalation out the nose. So here, how it happening? It will close the glottis. What will happen? It is only inhalation, exhalation only, but it will exhale explosively. The muscles, the abdominal muscles, and intercostal muscles will help forcefully to remove that irritant from that area. Epiglottis will close. Okay. What will happen? Suddenly, the explosion exhalation will happen to remove the irritant. Okay, understood how the cough and sneeze happen. Sneezing happen due to the irritant enter into the nasal mucosa. Cough happen due to the irritant enter into the uh, larynx, pharynx, trachea, and bronchi. So this is the exploration of expiration. Okay. So it is also situated in the medulla. Medulla will activate the reflex. And we have hiccups also. Hiccup also reflexes due to the spasm of diaphragm. Diaphragm is spasmed, so that's what we have hiccups. The result is quick inhalation. It is stopped when the glottis snaps shut, causing the hic sound. The stimuli may be irritating the of the phrenic nerves of the stomach. Excessive alcohol is an irritant that can cause hiccups. Such cause are simply unknown. Here, hiccups will happen. The whatever we have glottis, will make the sound. Okay, and diaphragm help. Mostly diaphragm and abdominal muscles will help. And in that, we have phrenic nerve, which is coming from the medulla, which the impulse which are coming from the medulla to the phrenic nerve, it will give the impulse very rapidly to the hiccups. Yeah, will get to the glottis. The glottis open its mouth rapidly, then hic sound will happen. But the reason is unknown mostly due to the diaphragmatic weakness and other reasons are given here. Okay. And another respiratory reflex is yawn. So everyone how yawning, including while giving the lecture. Okay. So how is happening? It is also a reflex. There are several possibilities such as lack of oxygen or accumulation of carbon dioxide, but we really do not know, nor do we know why anger is contagious. But seeing someone yawn is almost sure to elect your yawn of one's own. You may even have yawned while reading this paragraph about yawn. So basically, here also not any reason is giving, but whenever we are in stress condition, when we are in complete sleep, when we are in incomplete, we are in very stress condition, when you are in weak condition, and the other situation also a reason for yawning. Okay. So I think you understood about nervous regulation. Now we talk about chemical regulation. Understood about nervous regulation or any doubts?
Yes, sir, understood.
Good. Now we will talk about chemical regulation. Nervous regulation, only medulla and pons will help. We have phrenic nerves, we have baroreceptors, inhalation center, exhalation centers, and other centers. And hypothalamus will help, cerebral cortex will help. This is the function. Now we will talk about chemical regulation. Chemical regulation refers to the effect of breathing of blood, pH, and blood levels of oxygen and carbon dioxide. Here, chemical regulation will affect the blood pH. Okay, because oxygen is coming, carbon dioxide is going. if the carbon dioxide remains in the body, what will happen? The hydrogen ions increases and the blood become acidic. Understood? If the hydrogen ions are reduced, so what will happen? Blood become base. So nor we want base blood, nor we want acidic blood, we want medium. Okay. So which will help the body in equilibrium state. Basically, you have chemoreceptors, very, very important. Chemoreceptors that detect changes in blood gas and pH are located in the carotid aortic bodies and in the medulla itself. So we have baroreceptors. Here we have the baroreceptors, carotid arteries, aortic bodies, and in the medulla. In the medulla. In the medulla. Okay, in the medulla. So how is happening? Let's talk about that. A decrease in blood level of oxygen is detected by the chemoreceptors in the carotid and aortic bodies. The sensory impulse generated by these receptors travel along the glossopharyngeal and vagus nerve to the medulla, which respond by the increase in the respiratory rate or depth. This response will bring more air into the lungs so that more oxygen can diffuse into the blood to correct the hypoxic state. So basically, what will happen? The condition is hypoxia, means the decrease the blood oxygen level in the body. So what will happen? These baroreceptors, which are present in the carotid bodies, aortic bodies. So what will they do? They will activate. They will give the sense to the medulla through the glossopharyngeal nerve and vagus nerve. Glossopharyngeal nerve and vagus nerve. It will go to the medulla, and medulla increase the respiratory rate. So what will happen? The more oxygen will enter into the body. Okay, to correct the hypoxic state. So more oxygen will enter, so the oxygen amount is increased. So here you can take the example of in COVID. During COVID, oxygen rate is decreased. So what will happen? Patient will take abdominal breathing. Abdominal muscles are helping for breathing, means this is non-normal breathing. So this is the very, very important thing you have to remember during your clinical practice. Whenever a patient coming with gasping stage or abdominal breathing or shallow breathing, means that is the more important sign. You know, to treat immediately. And you have to connect oxygen to the patient. Then you have to treat the patient. Okay, means here one respiratory centers are activated, abdominal muscles are activated, and there is hypoxic state. First of all, you have to give the mask, oxygen mask. Then you can treat them. Okay. So, so carbon dioxide becomes a problem when it is present in excess in the blood. I told you that more blood of carbon dioxide, the more blood is acidic. Hypercapnia. So more oxygen is less oxygen, hypoxia. More carbon dioxide, hypercapnia. Lowers the pH when it reacts with water to form carbonic acid. It is excessive to makes the blood or other body fluids less alkaline, more acidic. Already I told you that. More carbon dioxide, more pH, more hydrogen ions, more pH. More pH means more blood is acidic. The medulla contains chemoreceptors that are very sensitive to changes in pH, especially decreases if accumulating CO2 lowers blood pH. The medulla responds by increasing respiration. It is not for the purpose of inhaling, but rather to exhale more carbon dioxide to raise the pH back to the normal. So basically, the medulla will activate in two conditions. When the blood, the oxygen is decreased in the blood, and second thing is the pH level are decreased or increased. pH decreased mean more hydrogen ions. More hydrogen ions mean the blood is in acidic condition. The same The chemoreceptors. Baroreceptors are present in the lungs. Chemoreceptors are present in the medulla. Will detect what their function. They detect. They have to detect the pH of the blood. If it is decreased, means in that conditions also inspiration increases to maintain the pH level. Okay. Of the two respiratory gases, which is more important as a regulatory of respiration, our guess maybe might be oxygen because it is essential for production of energy production of in cell respiration. However, the respiratory system can maintain a normal blood level of oxygen, even if breathing decreased to half the normal rate of storage for a few minutes. Recall that exhaled air is 16% oxygen. This oxygen did not enter the blood, but was available to do so if needed. Also, the residual air in the lungs supplies oxygen to the blood, even if breathing rate slows. So, understood here how the chemicals are helping. This is the diagram we will discuss. Therefore, carbon dioxide must be the major regulator of respiration. And the reason is that carbon dioxide affects the pH of the blood, as was just mentioned. An excess of CO2 causes pH to decrease, a process that must not be allowed to continue. Increase in the blood CO2 level is quickly compensated by the increase in breathing to exhale more carbon dioxide. Okay, basically all these are same thing here explained. In some situation, this is the second. In some situation, oxygen does become the major regulator of respiration. People with severe chronic pulmonary disease such as emphysema have decreased exchange of both oxygen and carbon dioxide in the lungs. The decrease is pH caused by accumulation. CO2 is collected by the kidneys, but the blood oxygen level keeps decreasing. Eventually, the oxygen level may fall so low that it does provide a very strong stimulant to increase the rate and depth of respiration. So basically, in some cases, like emphysema, in other respiratory problems, the kidney also helps to decrease to maintain the pH level, to eliminate the carbon dioxide. So basically, so we have the baroreceptors, okay, on the iotic bodies, on the keratoid bodies, which can to maintain the hydroxyl condition, and we have chemoreceptors in the medulla, which detects the pH level. So pH level is very, very important. So nowadays, we are eating high, large amount of acidic food. Basically, acidic food is very dangerous, very harmful because it will cause more carbon dioxide. More carbon dioxide will reach to the body cells. The cell respiration decreases. Cell need oxygen and glucose to maintain the metabolism. Okay. So till now, any we had yeah, here we have our diagram. We'll discuss the diagram. So basically, when oxygen decreases, what will happen? Chemoreceptors. Now, chemoreceptors will activate. It will go to the medulla and tell, please increase the inspiration. So inspiration increases, so oxygen increases in the body. Okay. Next, carbon dioxide increases and pH decreases. So what will happen again? But here in the medulla, we have chemoreceptors. It will detect the increase of carbon dioxide or decrease of pH. Again, inspiration increases. Inspiration will release more oxygen, and exhalation will release more carbon dioxide outside there. What will happen? The pH level will balance. Okay, any doubt here?
No, sir.
So we will continue our lecture. Only one topic is remain, that is the respiration and acid base balance.